And welcome to Minister Stephen Donnelly here with us today. And Minister, wonderful news, isn't it? Isn't it great as well to see the welcome across the whole chamber for this, and it's fantastic to see it. I mean, it is, I suppose my question around it would be that, of course, there is government commitments here, and I don't know, is it in the range of around 30 million or so to actually cover the costs that would have been there for the €80 that, you know, were coming in. So just, I suppose, what that government commitment is, because I know it's the highest budget ever, of course, in healthcare, that we're seeing nearly 23 billion in coming into health, and it's driving so many of these crucial changes that we're seeing. Minister, you also referenced, I suppose, some of the other areas where we've seen real progress. I really want to acknowledge the work as well, the support you've given to us in our local area around CHO2, along with Minister Rabbitte around the 436,000 for Weststock. That's made a huge difference for us in our area. It's hard to overestimate or underestimate the challenges we have around recruitment and retention of GPs in rural areas. I know it crops up for you, I'm sure, across many different areas, and I know in many different fields how we retain health professionals in regional areas at times. But I suppose some of the questions I just have, if I might, is just around the GP access to community diagnostics. Minister, that was really excellent. It was brought in, I know, over the winter to handle sort of the steep nature of the pressures within GP practices. And I know that was for people with medical cards and GP visit cards. I suppose that's moving to maybe another phase in the next while. I don't know, is there any other information on that? That's really where GPs would have been able to access, I think, X-rays, CT, MRIs and DEXA, maybe through private providers and potentially perhaps through some of our hospitals. The other area, I suppose, just to highlight that has been really fantastic to see is the 100 million you've mentioned for new medicines. And 1 in 3, of course, been orphan drugs for rare diseases. And of course, there's a new sort of cross-party committee as well on that in the Oireachtas. I really want to welcome in particular Kaftrio and what was done there with Cystic Fibrosis Ireland. I know that there was a huge campaign there around the 35 children that were outside of those lists. Minister, it's great to see that waiting lists, as you've mentioned, are falling, and I suppose there's lots of different initiatives there. I don't know if you might like to comment on perhaps how the NTPF scheme is operating or the cross-border directive in helping us reduce those waiting lists. And then I suppose just finally, Minister, I suppose for me in our area, it's around a little bit of capital infrastructure as well. So if I might, maybe just to ask for, again, to advocate for, I suppose, the EDs in regional areas. And again, just around the likes of Oireachtas, where we just saw huge pressures last Christmas. We do see investment coming into our GPs. However, the challenge is that there's still a high presentation coming into sort of our EDs, particularly around Oireachtas Hospital, which handles sort of nearly portions of nearly 5 counties where it's based. And the challenges are really around staff within that in tight spaces. They've been facing burnout over the last number of months, and just any sort of supports around that sort of modular infrastructure come next Christmas, and supports around that would be very, very welcome. Minister, thank you for this good news today. Go on, Margaret.